What is the primary goal of a care plan? A. To provide financial assistance. B. To outline dietary needs. C. To guide care based on patient needs. D. To replace physician orders. Answer: C. The care plan serves as a guide for all healthcare workers, outlining individual patient needs, goals, and preferences. Which of the following is a sign of dehydration in elderly patients? A. Moist skin. B. Frequent urination. C. Sunken eyes. D. Increased appetite. Answer: C. Dehydration often leads to symptoms such as sunken eyes, dry mouth, and decreased skin turgor. During a home visit, an HHA finds the patient lying unconscious on the floor. The patient is not breathing and has no pulse. What should the HHA do first? A. Begin chest compressions immediately. B. Call the patient's family for instructions. C. Notify the supervisor and wait for assistance. D. Activate emergency medical services, EMS, and then start CPR. Answer: D. The HHA should first activate EMS, call 911, and then begin CPR. Rapid response in such emergencies can be life-saving and is within the scope of trained HHAs. A patient refuses to take their medication, claiming it causes dizziness. The medication was prescribed and is scheduled at the current time. What is the most appropriate response by the HHA? A. Insist that the medication must be taken as prescribed. B. Report the refusal to the supervising nurse and document it. C. Hide the medication in food or drink to ensure it's taken. D. Offer the medication again after a few hours. Answer: B. HHAs must respect a patient's right to refuse care. Medication refusal must be reported and documented, and only a licensed nurse can decide the next steps. Which of the following situations represents a violation of HIPAA by the Home Health Aide? A. Discussing patient care with the nurse during a shift report. B. Writing patient care notes and placing them in the correct file. C. Sharing patient details with a family member not authorized. D. Confirming appointment details with the supervising nurse. Answer: C. Only individuals authorized by the patient can receive their medical information. Discussing protected health information with unauthorized persons violates HIPAA regulations. A patient with dementia insists that it's time to go to work, although they've been retired for years. The home health aide's best response would be: A. Remind them that they are retired and don't need to work anymore. B. Argue with them to help them realize the truth. C. Redirect the conversation and engage them in a calming activity. D. Tell them it's Saturday and work is closed. Answer: C. Arguing or correcting clients with dementia can cause distress. Redirection is the most effective and compassionate method to manage confusion. A client with Parkinson's disease is having difficulty eating because of tremors. What is the best technique the HHA can use to support the client during meals? A. Encourage the client to feed themselves as quickly as possible. B. Use weighted utensils and allow extra time for meals. C. Offer only liquids to reduce the struggle with solids. D. Feed the client entirely to prevent food spillage. Answer: B. Adaptive tools like weighted utensils help manage tremors. Encouraging independence while offering proper tools and time improves dignity and self-care. A home health aide is assisting with ambulation for a patient who recently had hip replacement surgery. Which of the following actions should be avoided to prevent injury? A. Supporting the client on the affected side. B. Using a gait belt while walking. C. Encouraging the use of a walker. D. Asking the patient to pivot when turning. Answer: D. Pivoting can dislocate a new hip. Patients should take small steps and avoid twisting the hip. Gait belts and walkers are safe tools when used correctly. A client with a history of congestive heart failure is on a low-sodium diet. During a grocery delivery, the HHA notices several canned soups and snacks high in sodium. What is the most appropriate next step? A. Remove the high-sodium foods from the house. B. Report the concern to the nurse and document it. C. Warn the patient that their heart failure will worsen. D. Allow the patient to make their own choices. Answer: B. While clients have rights, HHAs must report any concerns about non-compliance with the care plan to their supervisors. They cannot change diets or enforce rules independently. Which of the following best describes proper perineal care for a female patient who is incontinent? A. Wipe from front to back using a clean cloth with each wipe. B. Wipe back to front using one cloth for the entire area. C. Wipe from back to front using antiseptic. D. Wipe side to side starting from the back. Answer: A. Front to back cleaning helps prevent urinary tract infections by avoiding the transfer of bacteria from the rectal area to the urethra. A terminally ill client expresses anger and refuses to cooperate with care. What is the most appropriate response from the HHA? A. Ignore the behavior until it stops. B. Try to cheer up the client with jokes. C. Listen empathetically and offer support without forcing care. D. Remind them they must allow care as per the care plan. Answer: C. Grief can manifest as anger. The HHA must practice empathy in patients without confrontation or coercion. What is the most appropriate method for disposing of a used adult brief containing bodily waste in a client's home? A. Flush the entire brief in the toilet. B. Place it in a paper bag and leave it near the front door. C. Seal it in a plastic bag and dispose of it in the garbage. D. Wrap it in newspaper and throw it outside. Answer: C. Proper sanitation involves sealing soiled items in plastic before disposal to prevent odor and infection risk. Which situation best demonstrates an HHA's role in promoting client independence? A. Feeding the client to ensure they eat quickly. B. Encouraging the client to perform tasks they can safely do. C. Restricting the client from trying any task to prevent accidents. D. Completing all ADLs to reduce client stress. Answer: B. Promoting independence improves a client's dignity and mental health. HHAs must encourage self-care while ensuring safety. A client has difficulty swallowing medications. The HHA notices the client hides pills in their cheek. What is the correct response? A. Crush the pills and mix them with food. B. Monitor until the pills are swallowed completely and report to the nurse. C. Ignore it since the client might swallow later. D. Let the client decide how to take medication. Answer: B. HHAs must observe for safe swallowing and notify the nurse of any issues. Crushing medications without approval is outside their scope. While transferring a client from bed to wheelchair, the HHA feels sudden pain in their lower back. What should they do next? A. Continue the transfer and finish the shift. B. Stop, ensure client safety, and report the injury. C. Take a break and apply a hot pack. D. Ignore the pain if it's not severe. Answer: B. Any injury must be reported immediately. Continuing work may worsen the injury and compromise care quality. When assisting a client with limited mobility who has developed a stage 2 pressure ulcer on the coccyx, which of the following actions by the HHA demonstrates the best understanding of wound prevention and care? A. Massaging the area to increase circulation. B. Applying talcum powder to keep the area dry. C. Using heat therapy on the site to stimulate healing. D. Repositioning the client every 2 hours and monitoring skin integrity. Answer: D. Repositioning prevents further breakdown, and frequent skin checks help monitor the ulcer. Massaging or heat may worsen tissue damage. A home health aide observes that the client's medication bottle has a label that differs from the medication name reported by the client. What should the aide do first? A. Ignore it and give the medication as usual. B. Contact the client's family to clarify. C. Report the discrepancy to the supervising nurse or agency immediately. D. Ask the client if the medication is correct. Answer: C. Medication discrepancies must be reported to a licensed professional. HHAs cannot make decisions on medication safety. A client with advanced dementia refuses to bathe and becomes agitated when prompted. What is the most appropriate strategy for the HHA to take? A. Insist that the bath must be taken immediately. B. Report the behavior as combative and discontinue attempts. C. Leave the house and return the next day. D. Redirect the client to another activity and attempt the bath later with a calm approach. Answer: A. Dementia care requires patience. Redirection and a calm approach later can reduce agitation and improve cooperation. Which of the following is the most important reason for documenting all client care tasks immediately after completion? A. So the next HHA can do less work. B. To help the family know the tasks were completed. C. To maintain accurate records for care continuity and legal accountability. D. So the client can be reminded of the care given. Answer: C. Accurate, timely documentation is a legal requirement and essential for continuity of care. A client who is on a mechanical soft diet asks the HHA to prepare a peanut butter and jelly sandwich. What should the HHA do? A. Gently explain that the food may not be appropriate and notify the supervisor. B. Tell the client to call their doctor. C. Make the sandwich since it's what the client wants. D. Puree the sandwich so it meets the diet. Answer: A. Mechanical soft diets may restrict sticky or chewy foods. The HHA must follow diet orders and inform supervisors of any issues. What is the function of the respiratory system? A. Pump blood. B. Digest food. C. Exchange oxygen and carbon dioxide. D. Produce hormones. Answer: C. The lungs allow for gas exchange, vital for cellular function. What is a sign of elder abuse? A. Unexplained bruises. B. A broken hearing aid. C. Wrinkled skin. D. Using a cane. Answer: A. Bruises or injuries without explanation may indicate abuse. When should gloves be worn? A. Only during feeding. B. When touching clean sheets. C. During any contact with body fluids. D. Only if the client has a cold. Answer: C. Gloves are necessary to protect against body fluids and contamination. A client with Alzheimer's becomes confused. The HHA should: A. Argue with them. B. Provide calm reassurance. C. Leave the room. D. Yell to get their attention. Answer: B. Calm reassurance helps reduce confusion or agitation. Which action promotes client dignity during bathing? A. Leaving the door open. B. Rushing the process. C. Discussing personal matters loudly. D. Covering the client when possible. Answer: D. Maintaining privacy upholds the client's dignity. When assisting a client with dysphagia, swallowing difficulty, what is the most appropriate positioning during meals? A. Lying on the side. B. Reclining at 45 degrees. C. Sitting upright at 90 degrees. D. Lying flat after eating. Answer: C. Upright positioning reduces the risk of aspiration and promotes safer swallowing. A client is prescribed complete bed rest, but the aide notices redness and warmth on the client's calf. What should the aide do first? A. Report it immediately to the supervising nurse. B. Apply cold compress. C. Massage the area to relieve discomfort. D. Encourage the client to walk. Answer: A. Warmth, redness, and tenderness may indicate a blood clot, DVT. Immediate reporting is necessary. What is the main reason for using a gait belt when ambulating a client? A. To avoid bending. B. To exercise the client. C. To ensure safety and prevent falls. D. To make walking faster. Answer: C. A gait belt helps maintain control and stability during client ambulation, reducing the risk of falls. The HHA is assigned to assist a client with end-of-life care who becomes nonverbal and withdrawn. What is the best way the aide can continue offering emotional support? A. Ask the client personal questions. B. Offer presence, gentle touch, and listen if the client wants to speak. C. Play loud music. D. Talk constantly to keep the client alert. Answer: B. Nonverbal support such as presence, listening, and gentle reassurance is valuable during end-of-life care. When assisting a client with an indwelling urinary catheter, which of the following actions is correct? A. Hang the drainage bag higher than the bladder. B. Tuck the catheter tubing under the leg tightly. C. Disconnect the bag to drain it each hour. D. Keep the drainage bag below bladder level and tubing free of kinks. Answer: D. To prevent backflow and infection, the bag must stay below bladder level and tubing should remain unblocked. When assisting a homebound client who is partially paralyzed and expresses frustration about not being able to perform personal hygiene tasks independently, what is the most appropriate way for the HHA to respond? A. Encourage the client to be thankful for the help they receive. B. Remind the client of their condition and limitations. C. Offer adaptive equipment and promote the use of remaining abilities. D. Complete all hygiene tasks quickly to avoid further emotional discomfort. Answer: C. HHAs should promote independence and dignity by encouraging the use of adaptive equipment and assisting only when needed, supporting client self-esteem and autonomy. A home health aide enters a client's home and finds the stove left on with a pan burning. What should the aide do first? A. Call the supervisor immediately. B. Leave the home and wait outside for emergency services. C. Turn off the stove and move the pan to a safe area. D. Attempt to put out the fire with water. Answer: C. Safety is the top priority. If the situation is safe to handle, turning off the stove and removing the burning pan helps prevent escalation. Emergency services should be called only if the situation is out of control. When documenting in a client's home health record, what must an HHA never do? A. Use black ink for consistency. B. Cross out errors with a single line and initial. C. Document services provided truthfully. D. Leave blank spaces for the nurse to fill in later. Answer: D. Leaving blank spaces violates legal documentation practices. All records must be accurate, complete, and recorded at the time of service by the person providing the care. A client suddenly becomes confused and begins to wander near the staircase. What is the HHA's immediate priority? A. Call the nurse for instructions. B. Redirect the client to a safe area away from stairs. C. Restrain the client to prevent injury. D. Ask a family member to monitor the client. Answer B. The HHA must ensure immediate safety by gently redirecting the client away from hazards. Restraints and family involvement should only follow safety protocols and professional guidance. Which of the following best reflects the correct sequence when providing perineal care to a female client? A. Back to front with warm soap and water. B. Circular motion from outer to inner labia. C. Front to back with clean sections of the cloth. D. Upward strokes toward the vaginal opening. Answer C. Cleaning front to back prevents the spread of bacteria from the rectal area to the urinary tract, helping reduce infection risk. The client's care plan states that thickened liquids are required. Why is this necessary for some clients? A. It improves hydration. B. It increases the absorption of nutrients. C. It reduces the risk of choking and aspiration. D. It decreases fluid retention. Answer C. Thickened liquids slow the flow of fluid, giving clients with swallowing difficulties more control, reducing the chance of liquids entering the airway. A client tells the HHA that their family caregiver takes their money and doesn't buy their groceries. What should the aide do? A. Confront the family caregiver. B. Report the situation to the supervisor immediately. C. Suggest the client speak directly to the caregiver. D. Ignore it because it's a family issue. Answer B. Financial abuse is a serious issue. HHAs are mandated reporters and must notify their supervisor or follow agency protocols immediately. When taking a manual blood pressure, why must the cuff be at heart level? A. To ensure the heart rate is elevated. B. To prevent dizziness in the client. C. To obtain an accurate pressure reading. D. To reduce pressure on the cuff bladder. Answer C. Having the cuff at heart level ensures the reading reflects true circulatory pressure. If placed too high or low, results may be inaccurate. Which of the following is a key sign of dehydration that an HHA should immediately report? A. Slight increase in appetite. B. Dry mouth and cracked lips. C. Sleeping more during the day. D. Increased urination. Answer B. Dry mucous membranes and cracked lips can indicate dehydration. It must be reported promptly to avoid serious complications, especially in elderly clients. A terminally ill client refuses to eat and states, "I'm tired and ready to go." What is the HHA's best response? A. You need to eat something to stay alive. B. Let me call your doctor to see what they say. C. Would you like me to sit with you and talk for a bit? D. That's not a good way to think. Answer C. Emotional support and presence are essential in end-of-life care. Being available to talk without judgment respects the client's feelings and dignity. Why is it important for an HHA to follow standard precautions even if the client is not visibly ill? A. It avoids unnecessary contact. B. It protects the client from overexposure. C. It prevents the spread of hidden or unknown infections. D. It reduces the workload for the HHA. Answer C. Standard precautions assume all bodily fluids may be infectious, ensuring safety for both client and caregiver regardless of symptoms. An HHA notices a deep red area on a client's lower back that does not fade when touched. What should the aide do? A. Massage the area to promote circulation. B. Apply lotion and cover with a bandage. C. Report it immediately to the supervisor. D. Encourage the client to lie on it for pressure relief. Answer C. Non-blanching redness is an early sign of pressure injury. Prompt reporting allows interventions to prevent further tissue damage. Which action best demonstrates professional boundary maintenance? A. Accepting a gift from the client's family. B. Sharing personal problems with a client. C. Offering to care for the client during off hours. D. Politely declining invitations to personal events. Answer: D. Maintaining clear boundaries is crucial. Accepting personal favors or engaging socially may create ethical conflicts or legal issues. A client who uses a walker is found sitting on the edge of the bed and says, "I feel dizzy." What is the HHA's first action? A. Help them stand and walk slowly. B. Bring water and encourage fluid intake. C. Assist them to lie down with legs elevated. D. Report the episode after finishing all tasks. Answer: C. Elevating the legs while the client is lying down can help restore blood flow and reduce dizziness. Safety comes first. What is the most effective way to prevent the transmission of infection during client care? A. Wearing gloves at all times. B. Disinfecting the home daily. C. Proper and frequent hand washing. D. Using a face mask for all care tasks. Answer: C. Hand hygiene is the cornerstone of infection control. It should be practiced before and after every client interaction, even when gloves are used. Which of the following foods is not recommended for a client on a low-sodium diet? A. Fresh apple slices. B. Canned soup. C. Steamed broccoli. D. Plain oatmeal. Answer: B. Canned soups typically contain high levels of sodium and are unsuitable for clients needing sodium restriction. The client becomes angry and throws a cup across the room during a care routine. What should the HHA do? A. Yell back to establish control. B. Ignore the behavior and continue care. C. Calmly pause, ensure safety, and report the behavior. D. Leave the home immediately. Answer: C. The aide should remain calm, ensure no one is harmed, and report the behavior according to agency policy. Anger may indicate unmet needs or medical issues. A client's care plan includes range of motion, ROM, exercises. What is the main purpose of these exercises? A. To improve digestion. B. To increase heart rate. C. To prevent joint stiffness and promote circulation. D. To help the client lose weight. Answer: C. ROM exercises maintain joint flexibility, reduce muscle atrophy, and promote better circulation, especially in clients with limited mobility. The client is unable to speak but points to their mouth and stomach. What should the HHA do first? A. Check for signs of choking or difficulty swallowing. B. Offer water to soothe discomfort. C. Ignore it unless the client becomes more agitated. D. Contact a family member for clarification. Answer: A. Nonverbal cues must be taken seriously. Assessing for choking or discomfort is the priority before any further actions. Which of the following would be a violation of a client's privacy? A. Closing the door before personal care. B. Talking about the client's condition with another aide in a public place. C. Respecting the client's choice to refuse a bath. D. Storing client records in a locked cabinet. Answer: B. Discussing private health information in public is a direct breach of HIPAA and professional ethics, compromising client confidentiality.